What is psychology? Psychology is the scientific study of the mind and behavior. It focuses on understanding mental processes, emotions, cognition, and social interactions. Psychologists use various methods, including observation, interviews, and experiments, to study how individuals think, feel, and act in different situations. What is psychiatry? Psychiatry is a branch of medicine that deals with diagnosing, treating, and preventing mental illnesses and disorders. Psychiatrists are medical doctors who can prescribe medication, perform physical examinations, and offer therapy to patients with mental health conditions, using both medical and psychological approaches. Education and training in psychology. Psychologists typically have a degree in psychology, bachelor's, master's, or doctorate, and receive extensive training in counseling, therapy, and psychological assessments. They are not medical doctors and cannot prescribe medications, though they may work closely with psychiatrists to provide holistic care. Education and training in psychiatry. Psychiatrists are medical doctors who complete medical school, followed by a residency in psychiatry. Their medical training allows them to prescribe medications, diagnose mental health disorders, and understand the biological aspects of psychological conditions, such as brain chemistry and neurological factors. Methods used by psychologists. Psychologists often focus on talk therapy, behavioral interventions, and psychological assessments to understand and treat mental health issues. They use methods like cognitive behavioral therapy, CBT, psychoanalysis, and other therapeutic techniques to help patients cope with emotional or psychological problems. Methods used by psychiatrists. Psychiatrists primarily use a combination of medical and therapeutic treatments. They may prescribe medications like antidepressants, antipsychotics, or mood stabilizers to manage mental illnesses. In addition, psychiatrists often provide therapy, especially in more severe cases of mental health issues that require medical intervention. Scope of work in psychology. Psychology covers a broad range of topics, including developmental psychology, cognitive psychology, social psychology, and clinical psychology. Psychologists work in various settings, including schools, hospitals, research institutions, and private practice, helping individuals improve their mental and emotional well-being. Scope of work in psychiatry. Psychiatry focuses specifically on treating mental illnesses with both psychological and medical methods. Psychiatrists work with patients who have conditions such as depression, schizophrenia, bipolar disorder, and anxiety disorders, often using a combination of medication and psychotherapy to manage these conditions. Collaboration between psychologists and psychiatrists. Psychologists and psychiatrists often collaborate in treating patients, especially those with complex or severe mental health issues. While psychologists offer therapeutic interventions, psychiatrists can prescribe medication to manage symptoms. Together, they provide a comprehensive approach to mental health care. Conclusion. Psychology versus psychiatry. In conclusion, psychology is the study of behavior and mental processes, focusing on therapy and assessment, while psychiatry is a branch of medicine that deals with diagnosing and treating mental health conditions, often through medication. Both fields work together to improve mental health, but they differ in their approach and qualifications.